Hello, welcome back to the Innovator Series. My name is Roxanne Bamford. Today we are talking to Muri Raifu, founder and CEO of Talamus. So Muri, tell us what your innovation is.
It's basically a mobile-first platform that connects all the different players along the healthcare value chain. We did this in around the simple premise that healthcare should really be focused on the patient experience. And you start with the patient journey, and then you ask who are the people who are involved along the journey. How do you give them the tools to be able to effectively take care of the patient, but also to be able to effectively communicate among each other. We are in Ghana, Nigeria, South Africa, and Zimbabwe.
And have you had to pivot with COVID-19, or have you just been sort of building on your existing product?
Actually, our product was designed for these kind of circumstances. Our principle has always been, if I'm sick today, I should be able to find doctors easily. I should be able to connect with them. I should be able to find pharmacy. The doctor should have the tools to get the pharmacies closest to me to send information to. And they should be able to move the information easily. I should have directions to the place I need to get to. I should be able to pay easily from my phone. Those kinds of things that kind of tend to get between the patients being sick and the ability to get proper care in a timely fashion. You couple that with a centralized way of bringing in data and analytics. It allows people who are in charge of making decisions to make real-time decisions. The other thing that's an advantage for us is the relatively low cost of being able to deploy what we have. It's mobile. You don't really have to deal with this upfront capital expenditure of having to buy computers, servers, all of those things to maintain it, which is really a barrier for people to go digital in healthcare. We've managed to use something that everybody right now has and uses, which is their mobile phone. We're actually working with the Africa CDC as well in terms of the continent-wide strategy to leverage our platform for the COVID fight.
Are you planning to sort of expand into new markets, or are you sort of building on the existing markets that you're in?
First of all, I think with the COVID coming up, we've actually been working with governments already. And even patients who don't necessarily have COVID but have other issues that need to be addressed. One thing people remember from Ebola is that the number of people who died from other disease processes during the Ebola crisis was actually more than what the number of people who died from Ebola, because people just were not going to being able to go to the hospital to get the proper care. So we want to make sure that those people have access to healthcare during this time as well. Our idea is to be able to get all over the African continent. We have our app in French and Portuguese for that reason. Since COVID has happened, we've actually garnered interest here in the United States, as well as in Latin America. So soon our app is also going to be available in Spanish.
Are you kind of thinking in a sort of longer term trajectory with your product?
Absolutely. Can you imagine if a country can at any point be able to say, okay, a certain number of people are presenting in this particular area. There's an unusual spike of this set of symptoms over the last week. Maybe we should investigate. So a more targeted deployment of resources and more timely deployment of resources is really going to help us kind of catch things before they get out of hand, so that we don't then end up spending so much money to fix the problem if it happens.
Muri, thank you so much for joining us today. It's been amazing to hear about your innovation, and I wish you every success for Talamus in the future.